And what would be for yourself an indication to go to culture? Would that be after you've done cytology and you haven't had success with your first line therapy?
Yeah, well, it is very much response to therapy. So if you have diagnosed pyoderma with your cytology and you've treated appropriately, generally with cephalexin or sometimes amoxiclav at appropriate doses for 2 and 3 weeks of time, and when they come back in, still on those antibiotics, you're still seeing lots of bacteria and your lesions haven't resolved, and bacteria associated with neutrophils, then that's when I'll be reaching for culture. And that's exactly the same whether I would be in general practice or specialist practice. That's the criteria to be thinking about. Okay, this patient might have MRSP. And we see a lot of it every week, a number of them during the week now. So it is very prevalent in Sydney, and certainly we see some of the worst cases, so there'll be more there, but we're seeing it very regularly. So the other time that I culture up front is with a patient that has had confirmed MRSP in the past and they have a recurrence of pyoderma, and we've been trying to do everything we can to control whatever disease it is underlying that to prevent that happening. But before reaching for any systemic antibiotics anymore in that patient, in those patients, I'll always culture, assuming their cytology confirms infection again.
So you perform cytology as well at that visit, the same visit that you would collect the culture sample?
Essential. Absolutely essential, because you can't look at that skin and say the pyoderma hasn't resolved until you've done your cytology, because the lesions can trick you and you can't just rely on classical lesions. You can't confirm that without your cytology too.